going through the ABCs kind of cancer, once again with Dr. Tracey Weisberg, our medical correspondent. I want to ask you a little bit about breast reconstruction and what the options are these days and when it's appropriate, and kind of access to breast reconstruction for women.
Yes, so breast reconstruction is a really big part of healing for many women, especially women who have no option other than a mastectomy. And there's a couple different ways to do breast reconstruction. Just as a matter of delivering comprehensive breast cancer services, if you need to have a mastectomy, it would be nice if you could hear about breast reconstruction, and because most of the time it is preferable to do it immediately at the time of the mastectomy. And in more rural parts of America where there are not plastic surgeons available, this sometimes just is not a possibility, and the patients don't get referred until after they've had a mastectomy and maybe after they've had radiation, and then it just makes breast reconstruction more challenging. So ideally it's done at the time of the mastectomy, and a very common way of doing this is to place a tissue expander in the mastectomy site, which over the weeks and months to come is literally blown up a little bit like a balloon to stretch the skin. And then when the chemotherapy radiation is completed, then a permanent implant is placed. In some cases, a permanent implant can be put in immediately, and a lot of that has to do with the amount of skin a woman has and how big her breast is going to be, and whether or not she's going to need radiation or other treatments. But doing an implant or expander implant reconstruction is what many centers are able to do. It requires your breast surgeon to be working concurrently with the plastic surgeon. There are ways also of creating breasts using your own tissue. And a flap that is still done is called a tram flap. This is kind of the tummy tuck flap, and most women in their 50s usually have a little bit of that left over from stretching from pregnancies, and so this the muscle is raised with the fat and the skin, and it's kind of burrowed up under the chest wall and into the place where the mastectomy is, and the plastic surgeon constructs a breast mound using belly tissue. A longer surgery, a little bit longer surgery. It is a vascular flap, so you know it needs to be cared for. You're in the hospital a little bit longer. People who smoke cigarettes are at risk of having flaps like this fail, so we try to encourage people to not smoke. And then there's another flap called a deep flap, which tries to leave some of the abdominal musculature in place and create this flap. Because if you move all of that big muscle on covering your belly, then you can't do things like sit-ups and yoga and stuff like that. But it is possible to create a breast mound using the woman's own tissue. There's flaps that can be moved from kind of the back underarm, the latissimus dorsi flap. So there's all different creative ways that breasts can be simulated after a mastectomy. And I think, you know, the message is that if a woman is told she must have a mastectomy, that this is the only option, that she should, you know, the next thing should be, am I a candidate for breast reconstruction? Because most women are. And, you know, seek care in a place where that can be done immediately if she so desires. And, you know, there should not be any bias about who gets breast reconstruction, because young women want breast reconstruction. But we had an 85-year-old woman the other day who, you know, is very vital and golfs and skis, and she wants breast reconstruction. And it's all about healing and being a survivor and coming out of this feeling as good about yourself as you can.
But at the same time, I heard you say if you must have a mastectomy. And I'm also hearing a lot of women who write me and say, you know, I'm having it recommended that I just, you know, take them both off because I can get 2 brand new boobies that are perfect. And then I have others saying, I just want them off, off, off because they're my enemy. And they think that if they cut their breasts off, that no boobs means no cancer. And there's no guarantee of no cancer just because you have a mastectomy. And I get a sense that we might be doing a few more mastectomies that are absolutely needed. And let's be perfectly clear, this is a big operation, drainage things. You don't have feeling in the reconstructed breast. And even I just talked to a woman a couple of days ago, she said that down on her abdomen where they took all of that to make her breast, that she doesn't have any feeling down there either. Now, obviously, if you need a mastectomy, who cares what this is going to happen as long as you end up looking whole again so you feel good. But what about those concerns that maybe we're doing this needlessly?
So that's a great point, and it's been in the news lately.
Yeah.
And for most women, doing more aggressive surgery on the breast does not translate to a higher cure rate. And this is something that I think is hard to get your head around, but breast cancer really has 2 major components that we worry about. One is getting the tumor out of the breast and letting the breast look as nice as possible, largely because over time and multiple clinical trials, women have reported that their quality of life is better if they can keep their own breast. The women who have a mastectomy in early stage breast cancer compared to women who have the lumpectomy and radiation, their death rate is identical, meaning the risk of any of these tumor cells getting out into blood and lymph and circulating around and causing them to have breast cancer that comes back in their lung or liver or bone, that phenomena is going to happen whether they have a mastectomy or breast conservation. So in early stage breast cancer, the type of treatment that the breast receives seems not to impact your survival on the planet. Therefore, a mastectomy really should be offered to a handful of women as a first option. So who are those women? Well, if you are diagnosed with breast cancer and you are pregnant, you cannot have radiation. And so depending upon where you are in your pregnancy and how virulent your breast cancer is, those women get mastectomies. If you are a woman who has certain medical illnesses, although the notorious one is scleroderma, and thank goodness not that many women have this, then you absolutely cannot have radiation. The radiation makes your tissue just look so horrible and awful and ugly that you wouldn't want that to happen. Because the major goal of breast conservation is to keep the breast looking fairly natural. If you're a person who has a tumor in the north pole of the breast and the south pole of the breast at the same time, and some women do, they have multiple tumors in the breast, then doing 2 lumpectomies is going to make that breast look a little odd. And sometimes if the tumor is right underneath the nipple and the lumpectomy involves taking the nipple, then you might be left with something that looks like a volcano crater. And that, maybe isn't preferable. And then there's a lot of discussion about, well, who is it to decide what a nice looking breast is? And I should be able to decide that. And that's absolutely true. If a woman is happier having a breast that has a little bit of a crater in the middle than having a mastectomy, by all means, fine. But the goal of breast conservation is to get the tumor out, leave the breast looking nice, and the cure rate and death rate is not enhanced by doing a mastectomy. And then, of course, there's women who carry genes like the breast cancer gene, and they have a very high rate of getting a second breast cancer. And so these women frequently will decide to have mastectomies, that they don't live through this nightmare again. And I mean, that's very legitimate. So, I mean, there's really probably only a handful of women that must have mastectomies. And we strive for breast conservation. And I think if women understood that their death rate from this disease was not going to be affected by having more surgery, that it would be a lot easier to understand.